expect in this setting? Does he have pneumonia or does he not have pneumonia? Are there these patchy or fluffy infiltrates? What exactly are his inflammatory markers? Those are things that are looking to see whether he's in that phase where you have a lot of inflammation going on and then the danger goes up. Remember that in many people you have that first phase where the virus is replicating and people can have sort of milder, relatively milder symptoms, and then at about a week or so, it can really get worse. Suddenly a lot of inflammation, the body's inflammatory response is over-exuberant, and that can actually cause damage to every part of the body. So when they were talking about remdesivir and about the monoclonal antibodies, even though they're both experimental, that made sense, right? Because you're thinking, yes, it's experimental, we don't have all the facts, but it at least makes sense in terms of decreasing the viral load at that point. You want to try to keep the amount of virus down. And that was the decision his doctors made. And I want to emphasize that without us having all the facts, we're sitting here having all this speculation, but they're the people, and it's a good team of doctors from Johns Hopkins, I know, and elsewhere. So I'm just giving sort of my perspective, looking from the outside in, and not having all the facts. But when they said that his oxygenation dropped for a second time and they decided to give dexamethasone, the big trial in the New England Journal that looked at the use of dexamethasone, which is steroids, to treat people who have COVID, they found that there was a clear benefit to mortality, about 35% reduction in people who were intubated, who had a breathing tube. And some improvement, some reduction to a lesser extent in people who needed oxygen. But they said that they did not find a benefit to people who did not need oxygen. And we're being told that that's the category that the president is in right now, that he has a normal oxygen level without any supplemental oxygen. So you wonder if, could he be in a later inflammatory phase than we know, than they're telling us? Do his blood tests show that there are, in fact, evidence of a lot of inflammation? There was one little clue. They said, the doctor said that the numbers are of his blood tests are either normal or improving. So improving from what? So that's kind of a brain dump of where I am.
Yeah, I think that that's helpful for us to understand, because I think a lot of us have similar questions, especially given the conflicting information that we heard yesterday. I want to dig in a little bit more to the questions about the oxygen. White House Chief of Staff Mark Meadows said that the president was moved to Walter Reed because he had a fever and his blood oxygen level dropped rapidly on Friday. He was also on supplemental oxygen at the White House. Now that all of this has been confirmed after that initial dodging of the question before, does that change how we should be thinking about the president's medical condition? And just as a reality check, we know that the president is getting better treatment, probably more aggressive, cutting-edge treatment than normal people might receive because he's the president of the United States. But are these treatments typical for somebody, given his age and weight and otherwise his health profile, who has contracted COVID-19?
Well, the word typical, right? This is a brand new disease, and we're sort of we're building the engine as we're taking off. So there's nothing typical about anything with any of this. I mean, he's at an increased risk. He's 74 years old. He has age. He's male. He's technically is obese based on the last figures that we have. But, when your oxygen level drops down, you're wondering, is that because now the virus has damaged the lung to some extent and it's causing a decreased ability to get oxygen from the outside to the inside? I mean, sometimes if you have a fever and you're shaking and there's increased oxygen demand, that could transiently drop the oxygen saturation that would then return to normal. The other thing that we don't know is what is he getting that could be already reducing the fever. So one of the things we look at as a sign is, does he have a temperature? We're told that he doesn't have a temperature. Is he getting something to lower his temperature, which might make that hard to interpret, Tylenol or an anti-inflammatory? And now he's been on the steroids since yesterday. Guess what? Steroids can decrease the fever. And theoretically, one of the reasons why people are a little hesitant sometimes to give steroids in that first phase, when your body itself is trying to fight the viral replication, is that theoretically it's possible that steroids could decrease your own immune response. It's very tricky. But again, that's a kind of a clinical decision that his team is making. It is a world-class team. I actually interviewed Dr. Garibaldi for a piece on 60 Minutes that we did back in March. I mean, these are top physicians. So the last thing I'm going to do is second guess, but I will second guess the amount of transparency, because The first rule of public health is tell the truth, the whole truth, and nothing but the truth. And there is this instinct sometimes to try to just sugarcoat things. But, paradoxically, if you tell people the truth, if you level with them, and then they think you're leveling with them, even if the news is worrisome, the process itself is reassuring. So that's something that, and again, the doctor who gave the news yesterday, I think, that might have been one of the first times he was out in front of all these cameras. But there are mixed messages. And I think that the lesson here for everybody is the truth, the whole truth, and nothing but the truth.
Yeah, the fact that he was on oxygen, not necessarily concerning, or the fact that he had spiked a temperature, not necessarily concerning if we just know this, the standard course that had happened, and now he's doing better. But it was that evasiveness that really led to a lot of confusion and skepticism. I also want to ask you, Dr.
And he even acknowledged that. He said, he gives the opinion.
Yeah.
Oh, sorry. He said it gave the impression that maybe he was trying to be evasive. He said that, and I think that's the problem because these things, the inflammatory markers. Does he have pneumonia? It's not just out of sort of prurient interest. These are prognostic indicators. They help us to predict how the person is going to do, and this is the President of the United States. So he's getting all this treatment. He's getting all that he should be getting, in the kind of attention he's getting. But we do have a right, you're balancing the privacy of the patient with the right of the public to know what's going on. And, there's a lot riding on this. So I think, personally, I do think that we should be told more of the details. And specifically, did he have pneumonia? What's his chest CT show? And what did the blood test show in terms of inflammatory markers? That would help us get a much better idea of what's going on and what his prognosis is.
Get the Google app to search what you see and search with.
Yeah, one last question for you, Dr. LaPook. Dr. Conley said that the president may be discharged as early as Monday. The White House obviously has access to nearly unlimited resources, so it's not like being discharged to a private home. Still, does that seem surprising to you? What will doctors be looking for as they try to decide if and when he should be discharged?
Normally, and this is certainly not normally, you would not discharge somebody from the hospital to home at this time because we already said that, at day 7 or so, and we're not quite sure where he is in that illness, you could suddenly have a deterioration. So I've had patients, I was on the COVID wards at NYU Langone, where I'm a professor, in April, and we had patients who were fine at home, and then suddenly they deteriorated. They hit the emergency room, and they actually looked pretty good, and 15 minutes later, we were intubating them. So you don't want to let your guard down. The thing with the president is he's not going to a normal home. He's going to the White House. And I found out yesterday there's a lot of almost like an intensive care unit ability there from one of my sources. So yes, he would go to the White House, but hopefully there'd be a full staff there. And specifically, people who, if he did take a quick turn for the worse, would be able to do something even as dramatic as putting in a breathing tube. I'm not saying that's where he's headed, but you never want to take things for granted. You always want to be prepared for what's going to happen next, what's going to surprise us next, what's the worst thing that could happen next, and you want to be prepared for that. So I think that's really important, with any patient, and especially when you have a VIP patient. I think VIPs sometimes can get worse care than quote unquote normal patients because people take shortcuts and go around the corners and do things that the patient wants instead of the way, based on your scientific knowledge, that you think your clinical judgment says you should do this. So I would have the caution about leaving the hospital. That's their clinical decision. But I think given who's taking care of him and how responsible those physicians are and their reputations, I think that they're not going to send him home.